Bone health is the health of your bones. I think that as we are early developmental, reaching our skeletal maturity, age 18 or so, in those young age ranges, you're building the strength of your bones. Once you reach skeletal maturity, age 18 or so, you're no longer building bone, and then you start slowly losing bone, really the rest of your life. Females and males as well can get a condition called osteoporosis, or low bone mass is a little lesser form than osteoporosis. Affects females more frequently than males, but it's highly associated with fractures. One of the worst things that we think about is when we're older, breaking a hip. I think most people have somebody in their family or someone that they know that suffered a hip fracture. Other fractures that are commonly associated with poor bone health, osteoporosis, would be proximal humerus fractures, ankle fractures, all kinds of fractures that can be very debilitating and hard to recover from. And so obviously, if there's treatment options that can help improve your bone health, and at all stages of your life, doing some things to help keep your bones as strong as they can be, to help minimize your risk of fractures in the future. The other, problem that can develop when you've got weak bones are compression fractures of your spine. I think everybody has seen patients or people that they start to hunch forward and they develop a real curved spine, and that's typically from multiple compression fractures of their vertebrae. So it's obviously something we want to avoid as well. So bone health really starts when you're young. You want to avoid some of the risk factors of osteoporosis and poor bone health, proper nutrition. You want to make sure you're getting enough vitamin D in your diet, and you want to make sure you get enough calcium in your diet. Things like dairy and cheeses have good sources of vitamin D and calcium. Sunlight is important. We can convert vitamin D in the skin with sunlight. I think that there's significant concerns these days with sun exposure, with skin cancers and whatnot. We're not plowing the fields like we used to years and years ago, so fewer people are spending a lot of time outside. But just getting outside for 10 minutes, 15 minutes when it's sunny, go out and expose your skin to some sunlight. That helps to get the vitamin D into your bloodstream. Some of the symptoms of poor bone health oftentimes will have a sentencing event. The patient will present with a broken hip or a broken shoulder or some other fracture that's a wrist fracture, very, very common. And that should make an orthopedic surgeon, kind of wonder, is this person's bone a little weaker than it should be? Is that a risk factor for their fracture that they sustained? And I think at least in my practice, almost everyone who presents with a fracture, I think about their bone health. And typically, at the very minimum, you could get some vitamin D labs, calcium, parathyroid hormone, check into some of the common sources of poor bone health. Typically, we get a bone density test, which is also known as a DEXA study. It's very, very, very low dose radiation. You lay on a table. There's an X-ray tube that goes over top of the body. It doesn't take long, probably 10 minutes or less to get the scan. And that quantifies, passing some X-rays through the body, it can quantify the strength of the bone. It matches your numbers to the known data that we have out there published with what your bone strength should be. There's a number called a T-score. Anybody that's had a DEXA scan, they should kind of know their T-score, and it's kind of a measure of their bone strength. A normal T-score would be anywhere from +1 to -1. A T-score of -1 to -2.5 would be osteopenia. The new word for osteopenia is low bone mass. And if it's -2.5 or worse, -3, -3.5, -4, the more negative that number, the worse the osteoporosis, and the weaker the bones are. So we get a DEXA done. That's something we can do in the office here. It's not a long procedure, it's painless, and the radiation exposure is very, very small. And it really helps us to get a baseline. The first one you do is a baseline. We typically repeat that about every 2 years after that baseline, if there's reasons to do so. If you had low bone mass or osteoporosis, we'd want to evaluate how we're doing with our treatment, see if we can slow down that bone loss that you're experiencing. Treatments for osteoporosis, there's actually been a lot of progress the last few years. There's actually some very, very good medicines available to us now. We've got anabolic agents, which actually help to grow bone. Those are typically injectables for a year or 2 years of injections. Some of those are injections monthly. There's also some injections that are just every 6 months, like twice a year. And those can actually help to grow bone and increase your bone mass, so that the DEXA study might show increased bone mass. I think there's other medicines that are anti-resorptives. They kind of limit your body's ability to take away your bone. Some people that the balance between bone formation and bone absorption is really tilted towards excessive bone absorption. And so that really is taking away more bone than it should. And so we can slow down that process of bone absorption by using some of these medicines. And they're very safe overall. I think that there are always some side effects to all medicines. Some of the side effects that are touted, which are very, very rare, but there's osteonecrosis of the jaw that's a concern. You want to make sure that your dental health is good. You have good dental hygiene. You visit the dentist frequently, and that's a very small risk. And atypical femur fractures is another potential risk. But some of those risks can be mitigated by some holidays of your treatment. Let's say you're on an oral bisphosphonate, which is an anti-resorptive agent. If you take that for 5 years, sometimes we then can stop your treatment for another number of years before we start that back up again, and that can minimize the potential downsides to those medications. But by and far, patients benefit tremendously from these medications, and the risks that are associated with them are such a small concern compared to all of the fractures and disability that osteoporosis can cause.